It all started with a group of concerned citizens who were concerned about the foster care kids in the community. So they had a meeting with Clara Chamberlain, who was our founder, and talked about the need for a place for foster kids to go. There was no place at the time. Miss Chamberlain's answer to that was to open up her own home. It then became apparent to her that there was a greater need than just foster care housing, that there was a need for mental health services in the community, and so she started an intensive day treatment program. The mission of Chamberlains Mental Health Services is to provide developmentally appropriate, culturally sensitive mental health services to children and their families.
The kids who come here end up more centered, end up doing better emotionally, academically. They're better functioning in all areas of their life.
I was young. I was probably in the second grade, first or second grade, and I believed we were referred, my brother and I, because we got kicked out of a lot of daycare programs and kindergarten programs, and you know, my mom had a hard time keeping us enrolled in school.
Being a foster parent, we were looking for services for our children. We have had 7 boys come through our home, and they have the different needs, and somebody recommended Chamberlains, and we came, we saw the program, and said, okay, that sounds good. Fortunately, because of Chamberlains, we were able to continue to keep these children in our home through their help, through the therapy, through the therapist helping me as a parent.
It taught us how to listen to adults that were not our mother. We had a big problem before that, you know, paying any attention to anyone else. And it kind of taught us, you know, how to get along.
Obviously, when families need our services is because there are particular issues, and usually within the family or within the children. We want the families to feel that they can come to Chamberlains, that it's a safe place, and that the children can get their services that they need because we have qualified, caring staff members who will treat their children and treat their families with respect while providing the therapeutic services that they need. We have 3 programs, 3 core programs here at Chamberlains Mental Health Services. We have our day treatment program, which is on site, and which children come to our program.
The children are in the milieu for 3 hours a day, and they have a structured program there, and they learn social skills, and they learn how to express their emotions, and they learn how to talk about what is going on in their lives. They are given art therapy, they are given other therapies, and they have individual therapy every week also.
Well, I think that especially with day treatment, by the time a child needs, you know, is a good candidate for it, they don't really need convincing. Generally it's the parents, you know, what do I do? And you know, day treatment is good help for them.
We also provide what we call outpatient services, and these are services that we take out to the community, usually in a school setting, that we meet with children either individually or we meet them in group therapy out in the school community.
With the outpatient program, it has been found that children who are experiencing emotional distress, that the earlier they get services, the better off it is for the child. So with our outpatient services, we start seeing children as young as 4 and through age 17.
What it did was stabilize the behavior in school, so I wasn't getting phone calls or letters or anything from the teacher saying, you know, your child's out of control. And and then it ran into the home, you know, it's like, oh, tomorrow when you see blah, 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 you know, we're gonna talk about, you know, your great behavior. So the child gets all happy and he wants to do good.
The 3rd core program that we have here at Chamberlains is called supervised visitation. So it's a safe place for families to reunite and for children to visit with parents that they have possibly disconnected with or only can see during visitations.
We have 5 monitors, 3 of which speak Spanish, who meet with the child and the caregivers and oversee the visit. There's been a young woman who has attended our services. She has received counseling and she has received supervised visit help here. And she has gone from being unable to take care of her child on her own to now having her child in her home and being a functioning parent.
They gave us a lot of stability, I think, in the time that wasn't very stable. And probably gave my mom a lot of parenting tools that she needed at that time in order to, you know, kind of keep us under control a little bit better.
I would recommend the program because, again, it stabilizes children. It helps with parenting. If you have good relationship with a therapist, you start to really, you learn a lot of things, but the biggest part is for the children. The children benefit so much from programs like this. The things that they're not able to get at home or at school, it's programs like Chamberlains that help to become successful people.
Our clients that we have here, clinicians and the mental health providers community knows well about our wonderful programs here at Chamberlains Mental Health Services. It's my belief that the community as a whole doesn't know much about this little jewel here in Gilroy. And so I'm hoping that through this video and possibly through our website that we can make the community as a whole more familiar with our program and the needs that we have.
We want to continue to grow, and we want to continue to expand our services, and we want to continue to provide for Gilroy and South County what our families need here.